The Office of Rural Health is pleased to be a part of the Department of Veterans Affairs in supporting increased access to high-quality care for our rural veterans. The success of the long-term care shared decision-making model is contingent upon the participation of the veteran and, of course, of his or her team, which very importantly includes social workers and care managers. Your role in the facilitated discussion that will occur between the veteran and their family and caregivers and the whole provider team are critical. So thank you to our social workers and care managers for your support of this effort.
As the long-term care social worker, I was contacted by the community-based outpatient social worker out in one of the rural areas in Alaska.
My husband has Alzheimer's. He's almost completely blind, and he's hearing impaired.
The veteran is an 83-year-old gentleman named Mr. Strong. Luckily, he had his wife, Susan, who was his primary caregiver in the home.
As his disease progressed, it became less and less doable for me to be able to leave him home alone.
So she presented to the community outpatient clinic in crisis, really, and wanting to talk about what kind of services she can put in place to help care for her husband.
He needs to have in-home care if he is to stay in the home.
We sat down together and she brought in the worksheet that she had filled out, the caregiver worksheet.
Between myself and caregivers that are provided by the VA and the Alzheimer's Association, I am able to go out of the home and still have my normal life.
We used the worksheet to go through a lot of different things. I mean, we talked about services that are available in Alaska that we could put in place, but we also talked about services that are available in other parts of the country.
We have worked as a team in evaluating Joe's in-home needs and making sure that we're staying on top of them.
At the VA, one of our goals is to really support veterans in where they are and what their desires are, to stay independent for as long as possible. I mean, that's the point of most of the programs.
When working with veterans in rural areas in particular, sometimes it can be challenging to really broker resources, and there may be minimal community resources available to serve veterans in those areas.
In rural communities where there aren't a lot of services available, it can be really important for the VA to partner with community agencies. So veteran community partnerships can be a really useful tool to help build that web of care that really wrap around services that really encompasses all of the veterans' needs.
What we find is one of our key roles is educating community providers about what the VA offers. In fact, even some of the shared decision-making material we've been able to share with outside providers, because the Long-Term Care Services and Support website really encapsulates nicely what the VA does offer.
When you get groups of people who work on behalf of veterans together, they exchange information and they of necessity enhance each other's abilities to do their jobs. And that optimizes choice, and that's what we're looking for with the Veteran Community Partnership, is to optimize choice, and it's the same thing we're looking for with shared decision making, is to optimize choice by educating people about what's available to them, and thereby allowing them to select an approach to their care that best fits their needs.
Veteran-directed home and community-based services is a natural program for veterans in rural areas. By being able to kind of control your own care, being able to schedule workers when you need help, to be able to hire family members, neighbors, and friends to deliver that service. Wherever we've tried it in rural areas, it's been an unqualified success. There are also 2 excellent websites that have all the up-to-date information and a lot of educational material and background material about how the program operates.
I think that's one of the biggest parts of the program is they have control. They have control of their lives. And I think that's something that in this community and in most rural communities is really needed.
For the rural areas in particular, we really don't have a good mechanism to find out who is in need of this care. So the electronic wait list gives us a mechanism to be able to identify those that are in need of care so we know where to grow our programs. Programs that we include in our home and community care listing is home-based primary care, homemaker home health aid, geriatrics care, medical foster home, adult day health care, respite, hospice care, palliative care in the outpatient setting.
It's extremely important as VA social workers that we're properly using the electronic wait list when there are services that the veterans we're working with might benefit from or need, but that aren't readily available in the area that they reside, to accurately capture that need. This is a way for us to advocate for the veterans and caregivers that we're working with in rural areas in particular.
Electronic wait lists, sometimes they are kind of thought of as a dirty word, but they're really a useful tool. They are what helps us identify demand. If we don't have a way of tracking that, we can't show what our resource needs are. So it's really important to use electronic wait lists when you identify a service that somebody needs.
When interacting with veterans, VA social workers have a unique opportunity, and I would even say obligation, to inform them of the comprehensive array of long-term services and supports that are available to them.
I like to advocate that social workers are on the front lines of shared medical decision-making process. We have the tool set, we have the communication skills, we have relationship skills to build on to work with families and with veterans. And when we do that, we empower them to take care of themselves.
There's a lot of good information in there that I haven't been able to find through any other sources, myself anyways. There's things in there that sometimes you don't want to think about things that might happen in the future, but it sure is nice to know that the VA's got us covered.
When they come in for their initial clinic visit, we have a discussion about what their goals are, what priorities they have. And it gives me an opportunity to link their medical conditions, the complications of their medical conditions, and how this long-term service would benefit them in managing their medical conditions and sustaining their quality of life.
When you're involved in care planning on a day-to-day basis, it's easy to come in with an idea about what someone's going to need. And sometimes that can translate into presenting options that you think are going to be a fit for somebody. But the shared decision-making really enables us to make sure that we're putting the veteran and the caregiver's needs first. And by starting with that, you're really setting the foundation for their voice to build that care plan so that you're not just trying to fit them into the box that's convenient for, the staff or for you at that time.
The shared decision-making worksheets can be used in anticipation of perhaps an office visit with the social worker. For example, if I had spoke with a veteran or their family member on the telephone, I may want to mail out some information and resources to that veteran or family member ahead of meeting with them in person.
The shared decision-making worksheets and information on services and supports are available online. That makes it really convenient for veterans, caregivers, staff, even community agencies to access the information at a time and a place that's convenient for them. And then there can be a follow-up either over the telephone, through telehealth, through video conferencing, where you can go through those materials together and really discuss, the veteran and the caregiver's preferences and formulate a very individualized care plan that hits all of the high points.
What I try to do is I try to introduce the shared medical decision-making packet, and in terms of treating the veteran holistically. We like to treat all of the veteran, not just specific aspects of their care, but we want to know about all aspects that impact their care and how we can best service them. And by giving them the shared medical decision-making packet, not only do we give them the information, we give them empowerment. We give them information to say, I am making my own choices and this is how I want to direct my care.
We know that in our rural veteran population, over half of those seen by the VA are over age 65. So as this population ages, becomes more elderly, there are critical discussions that must be had between that veteran, their healthcare provider team, and their family or caregiver. So I invite you to participate fully and to adopt this model in your care each and every day. Thank you.